Hello, my name is Alyssa Lagme. I've been assisting Val and Julie with JABSOM Medical Records. Today I'm going to present a closer look at tuberculosis. So, TB is caused by a bacterium called Mycobacterium tuberculosis. It mainly affects the lungs and throat. Symptoms include, but are not limited to, a bad cough, coughing up blood, pain in the chest, weight loss, chills, fever, etc. TB can be transmitted through direct contact. Not everyone infected will become sick. There are two types of TB. There is latent TB infection, LTBI, and active TB. Latent TB means a patient carries the bacteria, but they have no symptoms and is not in a contagious state. The bacteria will remain inactive, but should be treated to prevent the patient from developing the disease. Active TB, if not treated properly, can be fatal. So, testing a patient for TB will happen with the standard mental TB test. This test determines if the patient has developed an immune response to tuberculosis. A doctor will administer this by injecting zero point 0.1 milliliters of 5 tuberculin units into the top layers of the forearm. Doctors will then read the skin test 48 to 72 hours after. Doctors will look for a reaction at the site of injection, observing the size of the raised area or swelling. If that area or swelling is above 8 millimeters, that indicates a positive result. So within the standard Manto TB test, you have the one-step and two-step. The one-step PPD is the shot being placed, then 48 hours later, doctors will read the results. The two-step PPD is a one-step placed in red to establish a baseline. So if that initial test is positive, no further testing is completed, the patient will then need to require further medical assessment, which is a chest x-ray. If that initial test is negative, a second test is subsequently performed 1 to 3 weeks later and read within the 48-hour time frame. So when a patient receives a positive result, doctors will need further medical assessment and order a chest x-ray. The chest x-ray is used to examine the lungs. Some examples may include infiltrates, which are pus or blood in the lungs, and or lesions, which is a lump of mass of tissues or hardened blood. When JABSOM medical students test positive, they will need to submit documentation of that chest x-ray showing hopefully no signs of active TB and complete our TB questionnaire yearly. So these are examples of what doctors will look for. On the left, you can see a healthy set of lungs, whereas on the right, at the ends of the white and black arrows, you will see small coin-sized lesions that are also referred to as pulmonary nodules. Drawing blood, the future of TB testing. How this works is when white blood cells are exposed to TB, they release interferon gamma. Interferon gamma is then used to activate the immune system to attack the TB bacteria. IgRA blood tests uses white blood cells to test for reactivity to the TB antigens. Measure of interferon gamma will determine the exposure to the bacteria. So there are two methods to measure. Doctors will look at the concentration of interferon gamma or the number of interferon gamma cells in the patient's blood. Quantiferon measures the quantity of interferon gamma in the blood sample, whereas the T-spot measures how many cells or spots are producing interferon gamma. 8 or more spots indicates positive, 4 or less is negative, 5, 6, or 7 is borderline. Some advantages include that these tests only require a single patient visit to conduct. Results can be available within 24 hours, and it does not boost responses measured by subsequent tests. What that means is that consistently drawing blood will not change a patient's sensitivity. Some disadvantages include that these blood samples must be processed within the 8 to 30 hour time frame. Of course, human error in transportation, administration, and interpretation may happen. There are limited data on the use of IgRAs to predict who will progress to TB disease. What that means is that there's not enough research done on IgRAs yet to determine if the patient will go from latent TB to active TB. And lastly, these tests can be expensive. On average, a patient may pay $90 in a lab setting, but without health insurance, a patient may pay up to $160 or more. Of course, we are always striving for efficiency. The IGRE's blood tests, the quantiferon and T-spot, may start to be the new standard way to test for TB. Thank you.